Muda ndio end life kwanza. Sasa unajua tunatembea. Eh? Oh, haya hivyo basi.
Mathari National Teaching and Referral Hospital has been in existence for 120 years.
It was started as a small box isolation center, but from around 1910, it has been handling patients with mental illness.
Our motto is healing minds, restoring lives, and touching families.
And our main objective of the hospital is clinical care for patients who have mental illness and substance use disorders.
The legal notice of 2020 that established Mathari Hospital as a parastatal has two strong mandates for this hospital. The first one is to offer specialized psychiatric services to the population of Kenya, and the second one is to offer training and research facilities.
Our first priority in the first 3 years was to remove these indignities from the patients that we were taking care of. So we set out to improve the accommodation facilities, to improve the spaces, clinical spaces where the patients were being seen, and to make sure that patients coming into the hospital are treated with dignity.
Recovery to addiction is a journey. So it starts from the first phase where you have management of the withdrawal symptoms. So then you follow up either the patient
Mathari National Teaching and Referral Hospital has been in existence for 120 years.
It was started as a small box isolation center, but from around 1910, it has been handling patients with mental illness.
Our motto is healing minds, restoring lives, and touching families.
And our main objective of the hospital is clinical care for patients who have mental illness and substance use disorders.
The legal notice of 2020 that established Mathari Hospital as a parastatal has two strong mandates for this hospital. The first one is to offer specialized psychiatric services to the population of Kenya, and the second one is to offer training and research facilities.
Our first priority in the first 3 years was to remove these indignities from the patients that we were taking care of. So we set out to improve the accommodation facilities, to improve the spaces, clinical spaces where the patients were being seen, and to make sure that patients coming into the hospital are treated with dignity.
Recovery to addiction is a journey. So it starts from the first phase where you have management of the withdrawal symptoms. So then you follow up, either the patient goes.
Mathari National Teaching and Referral Hospital has been in existence for 120 years.
It was started as a small box isolation center, but from around 1910, it has been handling patients with mental illness.
Our motto is healing minds, restoring lives, and touching families.
And our main objective of the hospital is clinical care for patients who have mental illness and substance use disorders.
The legal notice of 2020 that established Mathari Hospital as a parastatal has two strong mandates for this hospital. The first one is to offer specialized psychiatric services to the population of Kenya, and the second one is to offer training and research facilities.
Our first priority in the first 3 years was to remove these indignities from the patients that we were taking care of. So we set out to improve the accommodation facilities, to improve the spaces, clinical spaces where the patients were being seen, and to make sure that patients coming into the hospital are treated with dignity.
Recovery to addiction is a journey. So it starts from the first phase where you have management of the withdrawal symptoms. So then you follow up, either the patient goes for inpatient rehabilitation or an outpatient rehabilitation.
Mathari Hospital also has a very robust social work department that also integrates patients back home.
Huge number of patients are abandoned in the hospital. Currently, in the last financial year, we reintegrated around 208 abandoned patients. And among this number, we also had around 42 who are long-term. I would say that this challenge has largely been contributed by the stigma and discrimination that comes with the care and support for patients with mental health. And so families do not want to take our patients once we've treated, rehabilitated, and they're well.
Kenyans are becoming more aware of their mental health needs and how to promote their mental health and how to prevent mental illnesses. Kenyans are also aware when to look for therapy sessions, when to look for a psychiatrist, and where to look for these services. The other side of it is that as the demand increases, the services providers also need to increase. We are not yet there.
Today, what we have done is we have developed a strategic plan that will guide the hospital now going forward in order to be more systematic in ensuring that the indignities of the past are not repeated, but also that we have gradual improvement in the services, infrastructure, and the human resource in the hospital.
Having led this process to development of the first strategic plan, it is my desire that it is implemented fully so that we are able to offer the highest attainable of mental health care to our patients.
Currently, we are making the patient environment better. We are making sure everything that should be available for our patients and for the staff to be able to offer services is provided for, because we are essentially here to, to make sure our patients are comfortable and they get the services that they deserve.
Doctors in this place, nurses, psychiatrists have helped me to accept myself and also to take the second generation medication, which has helped me a lot.
I want to take this opportunity to wish Mathari a happy 120th anniversary.
I'd like to wish Mathari National Teaching and Referral Hospital a happy 120th anniversary.
The clinical department and myself, we really do wish Mathari Hospital a happy 120th anniversary.
And I take this opportunity to wish all the members of staff, our patients, our users, our partners, our board of management, our senior management, a happy anniversary. And let's look at the lessons learned and where we can improve as we celebrate the 120 years.
We are grateful to Kenyans and to people from all over the world who have given us the opportunity to serve, and we are hopeful that over the next 120 years you will see improvement and growth that will result in a facility that will be as different as we are today to what we were 120 years ago when we were established as a smallpox isolation center.
Haya, unakanyaga moja mbele, kanyaga mbele, Another step. Turn around. Turn, and step. One step. Turn around. Turn, and turn, and step. One step. Shoot over and around. Touch, shoot, and touch. Here we go now. Come on. And left and right, shoot over and right, shoot and left and right and left and right. Turn it. Left and right. Turn it. I do some it. Here we go. It's all slow. To the right, slow. To the left, shoot, go on. To the right, shoot, to the left, shoot, go on. To the right, shikilia kiuno, teremuka, teremuka, teremuka na utendishe, teremuka, teremuka we, teremuka we, haya juu namna hii, pamoja. Are we ready for this again? One more time to go. One, two, three, go. Now watch this. Go. Here it goes. Sure is. Look at you. Look at you. Shikilia kiuno, teremuka, 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 shikilia magoti, teremuka, rudi juu, rudi juu, rudi juu. Pigia mwenzako high five. Mwambie tunataka kuanza. Tafadhali naomba watu waje mpaka huku mbele. Let us come all the way up this point, please. Tuje kabisa na tusimame tufanye mziki kuingia. Just come all the way. Tafadhali tusimame tujipambe na hii. Wave at me like this. Let's do this together. Beautiful. I see you doing that. Let's go. Sing along. Sing it, man. Oh, my friend, just come on, let it. Step and step, I am telling you, let's go. To the left, to the right, left to the left, and to the right. Ay, 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 ay. Siku mzuri Mungu amejenga. Kanyaga rocha. Yes, sir. To the side, to the side, move to the side, to the side, turn it, turn it, turn it, if you up, turn it, come on, come on. I weka mkono ya baraka, right hand, teremka kidogo, teremka tu. Kama unapita na Yesu sema amen. Kama unapita na Yesu sema amen. Teremka tu, teremka tu, teremka tu. To the left. No, yeah, to the right. To the left. To the left hand, wave like this. Now wave 2 hand on the camera. Turn it. Ah, Mathari. You go. Keep going. Keep going. Okay, that's for now. And now stop me again. Another. Then you turn around. Oh, again. Step. Turn around. Turn around. Step and step, turn around. One more time. And you step, Sumuka, let's do another. Moja, Billy, Sumuka. Aya, watch it. Nataremuke Panagina. Even to the right. I think it's to your left, yeah? To your left, to your left, to your left, to your right, to your right, to your right, to your right, to your back, to your back, to your back, to your back, to your front, to your front, to your front, to your front. Now, where is it? Here we go now. Side and side. Handle, now handle, handle, now handle, handle, now handle. Put it. Handle. We go. Left and right, left and right. It is as simple as now. We try this together. We go again. 1, 2, 3, and then you jump. Let's go. And go. And then you jump. One more time. Kadang kadang pera suci. I'm doing it. Beautiful. Kudamba. High five nam smilia. Kata fadhali tupigieni makofi. Na msimame pia nyinyi mtujoin, si ndio? So that we can do this together. Hii ni ya kutoka kwa Wakamba. Kudamba ni msafi sana. Aya. Oza vinye Mogamba. Aya, twende hapo. Nenda chini. Namna hii. Ya. Just for this simple move. Twende hapo. Aya, twende. Chini. Two. And down. And up. Again. Down. And up. And up. Keep on seven. Keep going. Again, let's go here. Go. Chini, two. Chini, two. Weka mikono na hii sasa. The one to mtoto akwende shule. Down and up. I am the good number. You ready? Hear the feeling. Hear the feeling. Hear the feeling. Hear the feeling. Hey, I have to wait. Hey, why it too? I have to wait. Hey, terrible. Remember, I know what you mean. Remember, yeah, and it's a good suit up. You know, very good. See, to the book. I know. I didn't see it very cool. What do you do? May resume your just for a few minutes. Yeah. Then, if you're not dancing, at least you're appreciating. That's the way it works. Yeah. Beautiful. Okay. Now, a little bit slow as we also breathe a bit. Asante sana kwa wale wamepiga makofi. Kwa wale hawajapiga sasa ndio sehemu ya kupiga, pigeni tuko sawa. Thank you. Asante sana.
Elizabeth, but why did you have to go? Come back to your lovely Rochi. Yeah, Blackie boy Rochi. Don't you miss me, whatever they may say. Come back to your lovely Rochi. Oh, Jamanet leso vet kilia simweyo. Jamanele sobekilia simweyo. Iwe choke chamane troji. Yemi sobilo roji. Nega tuja moe moe. Iwe choke chamane troji. Jamane nyule sobe. Woi 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 woi. Tia timuranda di. Joy come and my sweet Elizabeth.
Asante sana.
Naomba tuwapigie makofi tafadhali tena. Ladies and gentlemen, we would want to advise that we will be starting our program immediately our chief guest walks in, anytime now. Therefore, as soon as they are into the dome, our official program starts. I'd like to also ask the students who are going to make a presentation to please thereafter we'll have a short prayer. May I ask that we do both the national anthem, one stanza, and the East African anthem. Naomba tusimame wote tafadhali. Please remain standing as we have a prayer. The chaplain who was to pray, please come forward.
Let us pray. Almighty and everlasting God, we come before you this morning to thank you and bless your holy name. We honor you, God, because there is none like you. And we want to thank you for this day. Because this morning, when we began this day, God, you have been taking care of each one of us. Thank you for the activities that we have done this morning, the walk, and everything that we have done. We want to thank you, God, even as we gather in this place. We pray for your very presence to be with us. We pray, God, that whatever we are going to hear this morning, let it be a turning point in our way that we shall start thinking, because, God, you created us and you gave us a body, soul, and mind. And for that reason, God, we want to thank you. Even as we remember our patients in this hospital who are mentally sick, God, we pray, Father, that even as we gather here, we are going to hear something, that even as we minister to them, as we take care of them, God, we are going to do it in a different way and in a special way. We honor you, we bless you. We pray for every speaker who will stand before us this morning to say whatever we are going to hear. May you guide them. We pray and ask this in the name of Jesus Christ, our Lord and our Savior.
Thank you very much for the prayer. Let's take our seats, ladies and gentlemen. Our chief guest, Cabinet Secretary for Health, the CEO of Mathari National Teaching and Referral Hospital, department secretaries that are with us today, the CEO of the Federation of Kenyan Employers, ladies and gentlemen, the chairman of the board of the Mathari National Teaching and Referral Hospital, the hospital administration, ladies and gentlemen, good morning. I hope it is still morning. Karibuni sana, welcome. Our chief guests, ladies and gentlemen, allow me to very my other world, I'm the director of Kayamba Africa. We have been at this business for 30 years. Please, that is where you clap. Yeah. I want you to start learning to clap. We are going to hear some good things this afternoon, okay? So let us start early. I would like to bring to the attention of our chief guest and our guests that while you were away, we were privileged, and we want to say a very big thank you. I'd rather say it now before later. I want to thank the Kenya Prison Service Band for leading us in the walk, and the director of music, of course, Chief Inspector Moses Kamau. Remarks. Ladies and gentlemen, let us welcome him with a round of applause.
The chief guest, Madam Waziri, Dr. Deborah Barasa, the chairman of various boards, representatives of various ministries, partners, sponsors, invited guests, hospital staff, our partners. It is my pleasure to welcome you to Mathari National Teaching and Referral Hospital. I'm sure you have had time to walk around. I have a little. You must have noticed that this is not the Mathari of yesterday. as a hospital, we have made deliberate efforts to invest in the reprevent mental health and put back the dignity that our clients have lost due to mental illness. Chief guest, distinguished ladies and gentlemen, mental illness, unlike physical diseases, trauma and injuries, is rather difficult if you don't know to appreciate who has it and who doesn't have. It does not affect a specific part of the body, and there is no specific laboratory test that is done to diagnose it. And because of this, there are many citizens, there are many Kenyans who are suffering from mental illness without knowing, neither are their families and close relatives aware that they have mental illness. And this is the reason why the World Health Organization has found it fit to have May as the month of mental awareness, mental health awareness, and also specifically to dedicate 10th of October each year to mark World Mental Health Day. As you can see from the poster here, this year's theme is, it is time to prioritize mental health in the workplace. This is really important because there is a connection between the mental wellness of the workers and the productivity. When workers, including health workers, they do not have sound mental health, their productivity is definitely impaired. And the output of whichever organization they serve is definitely affected. It suffices to say that our government has made a deliberate effort to invest in mental health so that we can drive the national development agenda. And in Mathari Hospital, we have committed to heal the minds of those who are mentally sick, to restore their lives back to socioeconomic productivity, and there touch their families, friends, and places where they work. That is why we say our business is healing minds, restoring life, and touching families. Madam Waziri and the invited guests, the workers here have dedicated a lot of their time and effort to restore the lives of those who have been afflicted by mental illness. And as Mathari, I want to say that we have a lot of work to do. Unfortunately, we do not have the adequate numbers of staff we want. We have done the necessary procedures. We hope your ministry, and I'm sure your interest in mental health, will see to it that we get the money to employ the requisite numbers of staff. Secondly, the hospital is in a dire need of acute psychiatry wards. People who have acute psychosis and acute mental illness, they require intensive care, like the people who are in intensive care unit. Unfortunately here, we put them in the same ward, which is not good for the patients who are on their way to recovery, and which puts a strain on the workforce. So we are requesting as a hospital that you provision for us funds to build at least 4 acute psychiatry wards. And lastly, Mathari National Teaching and Referral Hospital was gazetted as a level 6 semi-autonomous government agency or a state corporation under the State Corporations Act through legal notice number 165 of August 21, 2020, the transition has been protracted, and this has constrained the very motivated workforce we have from giving their best. There are many things we cannot do because our human resources and the finances are still being managed from the headquarters. The board has requested, as our the representative of the chair will say, that we request you extend the transition of this hospital into a full semi-autonomous government agency so that we can meet our mandate. After having said that, it is now my pleasure to invite all of us to mark this wonderful day here in Mathari, the International Day for Mental Wellness. So I welcome you all. Now, as I finish, allow me to invite the representative of the chairman of the board of directors of Mathari National Teaching and Referral Hospital, Dr. Charity Muraguri, to take 2-3 minutes and make our remarks.
The Cabinet Secretary of Health, Dr. Deborah Baraza, the CEO and the CEO representatives, fellow board members, esteemed guests, staff, and all other stakeholders. Good morning. Good morning once more. It is a great honor to stand before you today, and a historic moment too, as we launch our strategic plan 2024-2029 for Mathari National Teaching and Referral Hospital. This is not just another document, but a firm commitment and a milestone. So this is not just another document, but a firm commitment and a milestone in our collective journey towards elevating mental health care in Kenya. One that will align our efforts with national, regional, and global mental health agendas. Madam Waziri, today's launch marks the culmination of the extensive work rooted in the mandate of our hospital, which just goes beyond treating patients. We are an institution dedicated to providing specialized psychiatric care. As a teaching institution, we are dedicated to training the future healthcare professional and also fostering research to improve mental health care. In Kenya today, 34 counties have a psychiatrist and some mental health services. Majority of these are at our county referral hospitals and only 5 at sub-county hospitals. 13 counties lack any sort of mental health services, and they rely on their nearest county hospital or Mathari National Teaching Hospital for the services. To enhance accessibility of mental health services to Kenyans, we are making a plea to your office to facilitate establishment of psychiatric clinic and a substance and addiction clinic in every county. In the spirit of universal health coverage and in alignment with the global commitments to leave no one behind, this should be cascaded also to the level 4 facilities. For decades now, we have held several conversations, especially on stigma and discrimination to persons with mental health condition. It is a time for us to elevate this to the national level and establish policies that stamp out these attitudes. To many Kenyans with mental illness, they are actually suffering in silence. The strategic plan that we're going to launch today serves as a roadmap that is going to guide us through the next 5 years. Ladies and gentlemen, our story at Mathari National Teaching and Referral Hospital stretches back for over a century. It started from a humble beginning in 1904 as a small pox isolation center, in 1910 as a lunatic asylum, to our evolution into a teaching and referral hospital in 2013. And more recently, our status as a semi-autonomous government agency, that is the SAGAS, in the year 2020. The journey of Mathari National Hospital mirrors the growing recognition of the importance of mental health in Kenya and the broader healthcare landscape. Today, we are an institution equipped to offer the specialized services that the world's leading mental health organization advocate for, especially services that empower individuals to reach out their potentials, manage stress, and contribute productively to the society. The creation of this strategic plan that we're going to launch today has been a consultative process, incorporating many insights from staff, the management, and the board. It's a reflection that the needs and inspiration of Kenya as we are together. Together, as we brainstorm sessions, there has been surveys, workshops, and stakeholder meetings just to make sure that we have comprehensive insights. Madam Waziri, we have crafted a strategy that is both realistic and ambitious, that focuses on 3 thematical areas. These are operational excellence, quality mental health care, and growth and development. The plan is supported by a robust monitoring and evaluation framework that will track the objectives that have been set. A total of over 40 billion will be needed in the next 5 years to fully implement the strategic plan. The mental health care needs of our nation are huge. More and more new coverage continues to reveal the devastating outcomes of poor mental health. For example, persons dying out of suicide, the rampant homicides, and the menace of substance use among our youth. Without intervention, we expect these challenges to rise with the rising population growth and increased pressure of life. We not only depend on you to raise this budget, Madam Waziri, but we call on all our partners to support this budget and initiative. The Kenyan government, through the bottom-up economic transformation agenda, BETTER, has identified healthcare as a key pillar of development. And we, in the mental health, are fully aligned to ensuring that we ultimately contribute to the government's vision of Afya Bora Mashinani. This strategic plan has at its center the welfare of the staff. Today, we shall launch the employee wellness and welfare policy. The mentioned budget strongly advocates for increased human resource in all departments in this hospital. Acute shortage is not only a threat to the welfare of staff, but it is also a threat to the quality of services delivered. Our strategic plan is cognizant of, and it is in alignment with, prioritizing mental health at the workplace as the theme for today's celebration indicates. As we look to the future together, Madam Waziri, it is essential to acknowledge that we are also facing some challenges. Mental health care in Kenya and globally continues to suffer from underfunding and lack of resources, but also stigma. Our commitment in this strategic plan is on human resource development, capacity building, digital transformation, infrastructure, modernization, and establishment of an institute of mental health. With the help, we can be able to put this firm agenda together so that we can be able to ensure quality healthcare reaches all Kenyans. We are aware of the immense responsibility that lies ahead of us, but we are ready to take up on these challenges with confidence, armed with a strategic plan that reflects the needs of our patients, our staff, and our nation. Together, we can and will transform mental health care in Kenya. Thank you very much.
Thank you. Thank you very much indeed. Ladies and gentlemen, can we all give a round of applause to Dr. Charity Muraguri? I also want to appreciate the fact that Dr. Julius Ogato was able to make his presentation and then invite Dr. Muraguri. Madam CS, Daktari, I want to assure you from the demeanor of the CEO, he looks a very humble man. But I doubt if he's humble in the office. He must be a tough administrator. Ladies and gentlemen, how he has presented his case to Madam Waziri, you cannot ignore. And this is a very nice way of making presentations. And also, Dr. Muraguri has actually given us the outline of the strategic plan. And thank you for also acknowledging the fact that, indeed, one of the biggest challenges to mental health is just the stigma. We, as those of us who are from the outside, don't look at it that way. But I'm glad you have mentioned it. So, ladies and gentlemen, let's give a round of applause to both Dr. Julius Ogato and Madam Dr. Charity Muraguri. Makofi tafadhali. As we proceed, allow me now to welcome the chair of the Kenya Board of Mental Health, Dr. Kokonya, to make his brief remarks. Karibu.
The Cabinet Secretary for Health, Dr. Deborah Barasa, the Permanent Secretary, the CEOs present, the chairpersons, the Director of Family Health, all protocols observed. Good afternoon. My name is Dr. Donald Kokonya. I'm the chairman of the Kenya Board of Mental Health. The Kenya Board of Mental Health was enacted in 1999 when Kenya developed its first Mental Health Act. It is the oldest board in mental health. It is the national body that advises the ministry, the CS, and the county governments. And it has a mandate. The CEO is the director of mental health. By extension, this board falls under the Cabinet Secretary for Health. So when I sit down and the Cabinet Secretary comes and contradicts me, please know that's my boss. Allow me 1 minute to ask the board members just to stand up and wave to the crowd. Board members, please. Board members, Kenya Board of Mental Health, those are the board members. These board members represent all the health professions in Kenya, clinical officers, nurses, all of them. Kenya Human Rights Commission, they are on board. And they speak on behalf of all sectors of healthcare in Kenya. We have been in this country for long enough. The history of mental health has been highlighted by Mathari Hospital. I don't need to go back. I want to recognize and appreciate the special attention our new cabinet secretary has given to mental health. Those of us in mental health, we cannot take it for granted. We have to recognize it, work with the CS, support the CS, for the CS to support mental health. Thank you very much, Madam Cabinet Secretary, for that. I also want to share with you that for the first time, our new Cabinet Secretary invited us, chairmen and CEOs of state corporations under the Ministry of Health. It is the first in the history. It was very warm. In spite of her busy schedule, she managed to meet us and she left us all very happy. And I would like to pass the message to Madam CS. From the observation I had, my interaction, she has the support of the chairman of the board. And on my part, Madam CS, you have my full support. I'll work with you. That aside, as a national body answerable to the cabinet secretary, I would like to share my thoughts and share with this sitting today that the biggest problem challenging mental health in the country is the absence of a national mental health master plan. Because Mathari is just building on the structures that were built when this place was developed as a lunatic asylum in 1910. We have not had a master plan. And as a board, I want to commit myself to get an opportunity to share my thoughts with the CS, and I think the CS can invite us all. I don't need to be alone. Mathari, ourselves, psychologists, we need to come together and share these thoughts with the cabinet secretary. At the same time, the absence of our master plan to solve the very many problems, because this is what will describe what should be done where, will enhance access and equity to mental health care across the whole country. We know as a low and middle income country that only 15% or less of our patients are accessing effective professional mental health care in Kenya. 15%. We know 80% of mental health problems worldwide are in low-income countries like our country. But we also know that the same countries are not funding mental health. We are still using our own resources to support, but we know that at some stage. And I want to recognize the support the board received last year. The board generously gave us 50 million last year, and for the first time, we were able to inspect counties, and we compiled a report and provided it to the ministry. The second thing, this report showed that what we see in the press, what we hear, is not what's on the ground. We need to build mental health in the counties so that patients can access effective health care. We also would like to share with our beloved Cabinet Secretary that we have what we call health pillars. In this case, mental health pillars, starting with governance, financing, information system, human resources, service delivery, community, all those. And this will only work when we develop a master plan to roll out a national program. The other issue which probably I'll plead with the cabinet secretary because I'm answerable to her, is up to now we don't have funding for the board. And I would be grateful to get the funding. We are the people who assess quality assurance. We are the people who follow up on human rights abuses against mental patients. And we need to make the cabinet secretary aware so that she can act on it. And we're even happier that when we met the cabinet secretary, we all agreed that she will be our spokesperson. So whatever we do, we would like to bring to her. And when she pronounces, it has a bigger impact on mental health. The other aspect is to our practitioners. There is no way we can provide mental health without operating within a sphere of human rights. Kenyans are enjoying a lot of constitutional rights, but these patients must enjoy their full human rights and protection. Madam CS, there's a big problem. That problem is healthcare provision to mental patients, because insurance companies do not consider mental patients, yet this population is increasing. Madam CS, I don't want to ask you to give me an answer, but think about a way in which we can have access to healthcare for mental patients, maybe because they are unemployed. Developed countries have employed up to only 25% of their population. We don't have data here, but I believe it's less than 5%. So with poverty, unemployment, illness, we need to come up with a way in which if a mental patient goes to any health facility, he or she must get health care, either waiver or a way to be found. And on this case, Madam CS, we also want to ask you to remember mental patients when the health insurance schemes come up, when the universal health coverage, which we support, comes up, we would like to put our mental patients on board. Thank you very much.
Thank you very and his people. So we understand Dr. Konya had to also put a few issues to you. It is very much in order. Ladies and gentlemen, one of the pride of most and any institution is to showcase their talent. Therefore, allow me to ask now, as they walk on stage, the KMTC Mathari Campus Choir to because there are some people who are far. Please let's clap for them as they come on stage. I am informed they had a crash program in preparing for this. Mgeni wetu anaye washughulikia hali ya muziki anaitwa Bwana Elisha Nakale. Karibuni.
mental health. For global mental health, education awareness, advocacy against social stigma. World Mental Health Day is an international day for global mental health, education awareness, advocacy against social stigma. At workplace, let's embrace harmony and cohesion. At workplace, let's embrace harmony and cohesion. In schools, let's embrace peace and unity. In schools, let's embrace peace and unity. Society, let's not segregate mental health patients. Society, let's not segregate mental health patients. Indeed, let's embrace all, fight against social stigma. Indeed, let's embrace all, fight against social stigma. Indeed, let's embrace all, fight against social stigma. Let's embrace harmony and cohesion. At workplace, let's embrace harmony and cohesion. In schools, let's embrace peace and unity. In schools, let's embrace peace and unity. Society, let's not segregate mental health patients. Society, let's not segregate mental health patients. Indeed, let's embrace all, fight against social stigma. Indeed, let's embrace all, fight against social stigma. Indeed, let's embrace all, fight against social stigma.
Thank you very much. Thank you. Let's give them another round of applause, ladies and gentlemen. Mwalimu Elisha Nakale is the director. Tumpigie mwalimu makofi pia. Mgeni wetu Bwana Nakale, in another world, is one of the best Sikuti players in this country. I can attest to it. I've worked with him for many, many years. So thank you very much for that. Ladies and gentlemen, as we proceed, allow me to very quickly acknowledge that we do have partners. You remember the CEO did mention that they have partners. Dr. Muraguri also mentioned we have partners. Can I just, with permission, call upon the following? Let us acknowledge Kamili, CHEB, Johnson & Johnson, World Vision, HERAF, and also we have Empowering Disability. Moi University is also part of our partnership. Chanko Publishers, Shamiri Institute, Chiromo Hospital. Ladies and gentlemen, may I also mention that we do have the Ministry of Labor, very ably represented here by Dr. Baraza Wafula, who will be speaking to us a little later. Allow me now very quickly, Madam CS, to ask Kayamba to make one short presentation and then we proceed with the program. Karibuni sana, tupe nyimbo moja fupi kisha tuendelee na ratiba yetu.
To be upstanding so that we can enjoy this part. Tafadhali tusimame wote tuchangamkie siku ambayo leo we are celebrating a very special day And as Kenyans, we celebrate our country even before everything else. 20. Just still lose a bit. Swing side by side. Go. Side by side.
Tushangilie Kenya, taifa letu tukufu, Kenya tunayoipenda. Tushangilie Kenya, taifa letu tukufu, Kenya tunayoipenda. Twajivunia sana tukiita nchi yenye baraka. Twajivunia sana tukijiita Wakenya, nchi yenye makao letu ni nchi ya usalama, kamwe hatutaiacha. Kenya makao yetu ni nchi ya usalama, kamwe hatutaiacha. Kamwe hatutaiacha. Anayependa Kenya ni yule mwenye kupenda haki kwa watu wote. Anayependa Kenya ni yule mwenye kupenda haki kwa watu wote. Haki kwa watu wote. Ukipenda Kenya ujitenge na mambo yenye kuvunja amani. Ukipenda Kenya ujitenge na mambo yenye kuvunja amani. Matata Kenya, hatutaki matata Kenya.
Tell somebody, I see you, you see me. I look you, you look me. Here, bado tuko chini kidogo, twende kazi. Here we go. Set aside. Here we go. Here we go. Here we go. Set aside. Ongeza mabega kidogo. If you are happy, make some noise. Sawa.
Sirimane nipende uone nyako yango mambo winyi lilo Weteko chuna Anisoje nyako yango ane woi moro mukendi Weteko chuna Namo wacho mio mingili Tunakiwoko yeo Weteko chuna Anisoje magotindo I love you. Sing along. I love you, you love me. Tell somebody you love me. I see you, you see me. I see you, you see me. I love you, love me. I love you, look at me. Love me. Look at me. I see you, you see me. I see you, you see me. I look you, you look me. I look you, you look me. I love you, love me. I love you, let us go. Love you, love me. I love you, let us go. Let us go. Go, 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 go. I love you, let us go. Chuamane nibelelari na konyango mago wanililo Weteko chuna Ayawekele mkono hapo kundo ane hori moro moro milia Weteko chuna Naguwacho mio mingli Tonya kiwoko dela Weteko chuna Anisoje magotino Baby I love you I love you, you love me. I love you, somebody love me. I look you, you look me. I look you, you look me. I love you. Are you telling somebody? Love me, I love you, look at me. Love you, love me. Love you, look at me. I see you, you see me. I see you, you see me. I kiss you, you kiss me. I kiss you, you kiss me. I I want you. Love me, I love you. Let us go. Love you. Yes, love me. Love you. Let us go. Let us go. Down. Return. Keep it there. Thank you. You may find your seats.
Thank you very much. Tuwapigie makofi tena tafadhali. I want to issue a caveat. Do not try this at home. I know some of you will say, but we are doctors. But in my small knowledge, I understand there is an oath you do called the hippopotamus. The hippo something that does not allow you to treat yourself. Ladies and gentlemen, a little entertainment is good for our health, especially mental health. Madam Director, I want to just say I'm also ambitious. I can give you some of my requests. They are not monetary, like the other doctors did. Mine is very simple. I have noticed, and this one I'm saying with a lot of respect, about 2 weeks ago, we were celebrating 20 years of AIHD, which is, they also deal with mental health, by the way. And our chief guest was none other than your PS, Mary Muriuki. I was happy to have met her. Unfortunately, as we are aware, she lost the dad a few days ago. I noticed that as soon as I finished that function, yesterday in Naivasha, I was with the Minister for Tourism, Madam Miano, in another launch. And then today, I'm with the Minister for Health. You can see I've got ambition. If you can now take me up, I won't mind. It does not cost anything. I'll just say, ama namna gani? Si kila mtu anajitetea hivyo. So if I'm able to, after you, unanipeleka kwa uko juu, itakuwa sawa. Allow me to proceed with the program. One of the best thing to listen to or to hear are witnesses and perhaps real-life lived experiences. May I humbly request, and if she can be given a cordless microphone to use, Daisy Kwamboka to round of applause as she walks up. Come on stage.
Invited guests, all protocol observed. Good afternoon. That emphasized the importance of education and community. I attended KMTC Mathari. I graduated in 2020, and currently I'm working as a psychiatrist nurse here at Mathari Hospital. For a long time, I struggled silently, feeling as though I was trapped in a fog that I couldn't escape. It affected my daily life, my relationships, my sense of self. Eventually, I reached a turning point where I realized that I needed help. I began therapy here at Mathari Hospital, which provided me with a safe space to explore my feelings. With guidance from my therapist, I learned that it was okay not to be okay, and that seeking help, professional help, is a sign of strength. At Mathari National Hospital, they always supported me throughout my journey. Thankfully, I work in an environment that always prioritizes mental well-being of their staffs. From the very beginning, I found a supportive culture that encouraged open conversations about mental health. My nurse managers were very understanding, allowing me the flexibility to attend therapy sessions as many as I wanted. The flexibility not only alleviated my stress, but also made me feel valued as an employee. Another big support that's up to date, I always say it was a win for me, is when the accommodation committee offered me a house at Mathari Hospital. Now I don't have to struggle for transport to work. I find it so easier for me. As a patient at that time, I experienced some challenges. I often faced feelings of guilt and shame for not being able to just push through. This made me hesitant to seek help as I feared being judged or misunderstood. Another challenge was the battle with motivation. Simple tasks like getting out of bed and coming to work was I felt it was a big challenge. I learned that it was okay to seek for help, and that seeking support is a courageous step. Anyone who faces mental health challenges could just consider. During that time, I of course faced some stigma and discrimination, not from the institution, but from outside. But majorly, they were because most of the people in the society are not well informed about mental health. Like I remember my dad that time, after discharge, he always asked me if I was under drugs, like bang or alcohol. And my mom on the other side was questioning herself if maybe I was bewitched or anything. But I couldn't have judged them because they had no information about mental health. They supported me fully, and I thank them for that. Mental illness can take many forms like anxiety, depression, bipolar disorders, schizophrenia, mood disorders, OCDs, and substance use disorders. These conditions are just like the physical illnesses which interfere with our daily lives. They are health issues that deserves compassion and understanding. There is a wealth of support available for those who are struggling. First, professional support is key. We have therapists, we have counselors, we have nurses, we have psychiatrists who are trained to provide necessary tools to help individuals manage their mental health. Another step is encouraging open conversations like the one we have today, and even giving people as a platform to share their experiences. Like for me personally, standing before you is a step of acceptance. We also need to avoid discriminatory language and attitudes even towards our patients. We should consider mental health care and awareness at all levels of healthcare services, creating awareness in high schools, colleges, and even universities, and conducting more outreach clinics in our society. Being mindful of how we talk about mental health can promote a culture of acceptance rather than judgment. As someone who always used to see darkness and thought that taking my own life was the only way out, I'm so proud to stand before you today I'm so proud to stand before you today, encouraging you to consider owning your mental illness instead of it owning you. So, ladies and gentlemen, thank you all for listening and being patient.
We've done it already. We've done it already. We've done it already. Yeah.
Wow. Another round of applause, ladies and gentlemen. Thank you so much. Please take your seats. I want to say, indeed, it's a proud moment. This conversation and this kind of spoken words must spread countrywide. I'll repeat, Dr. Moraguri, you insisted, each county, if possible, should experience not only the doctors talking about the treatment, but also those who have gone through this lived experience. We are very proud of you, Kwamboka. Let us give her another round of applause. And thank you, the support staff. Thank you very much. Indeed, the journey continues. The healing journey continues. Ladies and gentlemen, I even want to further say that indeed, it's only through an experience that you will find somebody who can understand and treat others. I'm proud of this institution for the fact that they have taken one of their own patients and they are now using that patient to heal and help those who have these issues. That by itself is a testimony that this institution is indeed in a level that it should be. Ladies and gentlemen, we continue with our speeches. However, allow me to also inform the audience that we also have as partners Pharmaceutical Society of Kenya, Child Fund, we have the University of Nairobi, Chiromo Hospital, Rotary Club, Inbust, Rotterdam Guests, Kenya Medical Social Workers Association are also here with us, and finally, National Spinal Injury. Our chief guest, as we proceed, I want to now ask that we do hear another lived experience from Joy Kate. If Joy is here, kindly come forward. Let us welcome her with a round of applause.
Our chief guest, Cabinet Secretary, Minister of Health, Dr. Deborah Barasa, principal secretaries from various ministries, chairmen of various boards, various partners, CEO, Mathari National Teaching and Referral Hospital, all protocol observed, ladies and gentlemen. Good afternoon. My name is Joy Catherine Nyambura Jero, a mental health champion who is a user of psychiatry services for over the last 26 years. I have worked at the Minister of Health headquarters for 14 years as an office administrator. I am also a qualified licensed counselor psychologist who graduated from University of Nairobi. I was born and raised just like any other child. I went through primary school and high school, but unfortunately, during my first year in college, when I was only 19, I was hit by a very serious depression, which left me and everybody in the family devastated. We came to learn that it was bipolar disorder, a type of mental health condition. I was admitted in Avenue Hospital, and since then, I have experienced multiple hospitalization in both private and public hospitals in this country. During my first hospital admission, which was early 1998, the doctors reported that I might recover or not. In addition, I remember I didn't have even a single college certificate, but today I have qualifications up to higher diploma in secretarial studies, as well as a Bachelor of Arts in psychology counseling, and I have plans to proceed further. Sky is the limit. In fact, I came for my internship in this institution when I was doing that course of BA in University of Nairobi. At my workplace, I have been awarded accommodation letter as one of the most trusted office administrator with outstanding performance, which depending on the Civil Servants Code of Regulation is only authorized by Principal Secretary. Before I joined civil service, I worked in some few organizations in private sector. Unfortunately, I could get relapse, and when this happened, I would be laid off on grounds of mental illness. This made me devastated, isolated, and made me hopeless. Oftentimes, I would develop suicidal ideations, which I struggled to control. I'm grateful to God and to the government since they have given me an opportunity to work, to be productive, and contribute to national development despite my medical condition. I urge the government to establish employee wellness program at the workplace. I am also grateful for insurance cover because medicines and admissions are very expensive. The struggle of getting medicines which have lesser side effects, these medicines are quite expensive in the sense that there is a limit of the amount you can use by insurance cover as well as where you can get them. I also have diabetes and hypertension, which is common among people with mental health conditions. For those who don't know, mental illness is considered as invisible psychiatric disability and qualifies for tax exemption of a certain amount when you are registered with National Council for Persons with Disability. I enjoy this facility. I am deeply grateful to my bosses and colleagues who took me to hospital and supported me when I fell ill at work. From the beginning of my diagnosis, I developed a mindset of, I can't, it is impossible. I wondered if I would never make it. I want to assure you, Madam Waziri, with God and positive attitude, positive support from family, health sector, colleagues at work, spiritual support, good Samaritans, giving up should not be part of my vocabulary. And also this means that there is life even after being diagnosed with mental illness. There is no challenge I have not gone through. For instance, there was a day I relapsed and got lost for days, leading to both sexual and physical abuse. I have been denied employment by some employers, rejected in relationships, called names, and defined by the condition I suffer from, for instance, joy who gets mad. With these few remarks, I am glad our country joins the global community in marking this day as we sensitize and create awareness on the importance of mental health. If you are there and suffering from mental health condition, don't lock yourself, for you are not alone, and do not limit yourself. I have learned this lesson as a survivor of mental illness for over 26 years today. That I can't stop the ways of life which brings about mental illness, but I can learn to serve them. Living well with mental illness, you must learn to ride the waves of pain, fatigue, or disability, instead of fighting against them. Mastery is not about control, it is about being on the path of serving the ways of life in order to feel in control. In fact, attempts to actually control the events in our lives paradoxically result in feeling helpless, hopeless, and depressed. Servants don't control the ocean or even waves they ride, yet they feel in control by learning to ride what they can't control. Together, we can fight it. Thank you, and may God bless you. God bless Kenya.
Thank you. Please take your seats. What a clever girl. Simeona your speech. I don't know. I used to be a teacher. And I think these two people who have made fantastic speeches here and presentations, they must have gone through me. For your information, a lot of us always come and say, ladies and gentlemen, all protocols observed. It is not protocols observed. Both of them said all protocol observed. Protocol is an acting word. It's a doing word. Wale wamefundishwa leo, pigeni makofi. Our chief guest, this is a very beautiful function. I'm lucky and happy to be here. And I want to be honest with you, I didn't reach university, but I try to take advantage. I normally sit with professors, engineers, and people like that. And when they speak, I steal their knowledge. So last night when I told them I'm coming here, one of them asked me, Juma, why are you going to that institution? What is wrong with your head? I said, you know what I'm going to learn tomorrow? I'll tell them this evening that perhaps those of us who were there yesterday, we need to come here, and then you come and join me. Because this is a beautiful experience that a lot of people must learn. Let's clap for ourselves for a fantastic day. Our chief guest, we are going to have a very short presentation of a video presentation of the Mathari National Teaching and Referral Hospital strategic plan. It is short, it has a few testimonials, and then we will move to the speeches proper, where I will be inviting Dr. Wafula Baraza, who is here to represent the PS for Labor. The video, please.
For over a century, Mathari National Teaching and Referral Hospital has stood as Kenya's beacon of hope in mental health care, healing minds, restoring lives. Today, we embark on a transformative journey, one that will redefine mental health services in Kenya and beyond. Introducing the Mathari National Teaching and Referral Hospital Strategic Plan 2024 to 2029. A bold, innovative roadmap guiding us towards a future of excellence. Our plan is centered around three critical themes. Operational excellence, ensuring that every service we provide is seamless, timely, and client-centered. Quality mental health care, improving the mental health outcomes for every Kenyan who walks through our doors. Growth and development, expanding our reach, strengthening our infrastructure, and advancing research and innovation in mental health care. Over the next 5 years, we will expand our specialized services, integrate cutting-edge research and technology, and create new opportunities for training the next generation of mental health professionals. Collaboration is key. This strategy invites local and international partnerships to join us in scaling up our services, ensuring no one is left behind in accessing mental health care. As we implement this vision, we aim to become a global center of excellence, pioneering new standards in patient-centered care, innovation, and compassion. Together, with dedication and purpose, Mathari National Teaching and Referral Hospital, healing minds, restoring lives, and touching families.
Thank you very much for that video, ladies and gentlemen. We are now moving to the speeches proper. We will ask that I will not be coming back until we reach the level where we will be launching the strategic plan. Allow me, before I invite the next speaker, to also recognize the Kenya Psychiatrists Association. They are also our partners, they are here, and the Kenya Counselors and Psychologists Board. They are also here. Can we all give a round of applause to all our partners? And we say thank you very much for finding time to join us. Ladies and gentlemen, it's with great pleasure to ask Dr. Wafula Baraza here on behalf of the PS for Labor to come and make his presentation, and then I will ask him to humbly invite our chief guest to speak. Tumpigie makofi akija.
Our chief guest, the Cabinet Secretary for Health, Dr. Deborah Baraza, the chairpersons of various boards that are around, the CEO of Mathari National Teaching and Referral Hospital, all protocol observed. Good afternoon. My name is Dr. Baraza Wafula from the State Department of Labor and Skills Development within the Ministry of Labor. I'll be representing the PS, and humbly allow me to relay my greetings from him, that is the PS, and the Secretary of Occupational Safety and Health. Indeed, this year's theme, which is it is time to prioritize mental health in the workplace, reiterates the importance of promoting a safe and healthy working environment that fosters decent work as a fundamental human right. And as you remember, the Directorate of Occupational Safety and Health is mandated with the task of ensuring that all our workplaces are safe and have a healthy environment for every worker, be it in the psychosocial, be it in the physical, be it in the biological or chemical realm. And that's why this theme is very relevant to us. It's also important to reiterate that mental health conditions have an impact on the workforce. We are talking about 12.6 billion hours of manpower lost per year. And if we were to look at it in terms of the monetary value, we are talking of values north of 1 trillion USD per year. This is in line with the ILO Conventions 151 and 187 that aim to protect both the physical and mental health of workers and to prevent occupational accidents and diseases. Similarly, Convention 190 on violence and harassment directly addresses one of the workplace known risk factors that are known to worsen mental health issues. Remember that the workplace can be a stressor, but at the same time, it can be an enabler on a patient's well-being, because once they lack work, then there's a gap which may just worsen their mental health issues. Cognizant of the importance of mental well-being in the workplace, the State Department of Labor and Skills Development, through the Directorate of Occupational Safety and Health, has made incorporation of mental health awareness and promotion of mental well-being a priority area. And this is being revamped into the existing Occupational Safety and Health and the Work Injury and Benefit Act frameworks that exist, and prerequisite legislative work is actually ongoing on that front. And even as government makes deliberate efforts to improve the work environment, we call upon workplaces to proactively incorporate psychosocial hazards in their routine risk assessment that they do annually. We are committed to work with the rest of the tripartite partners and other relevant stakeholders, including the Ministry of Health, to have an all-hands-on-deck approach towards making this year's theme a reality in all workplaces in the country. Thank you. Now, at this juncture, I would like us to stand up as we welcome the chief guest, the Cabinet Secretary, the Ministry of Health, Dr. Deborah Baraza. Let's clap for her as she comes.
Yes, please do have your seats. Thank you so much. Mathari National Teaching Referral Hospital CEO, Chairman, committee members, partners, ladies and gentlemen, good afternoon. Thank you so much. It is indeed my great pleasure and honor to join you today for the commemoration of the World Mental Health Day. This annual event serves as a crucial reminder of the importance of mental health and the need for destigmatization and prioritization of care. The theme for this year, it is time to prioritize mental health in the workplace. And this reflects the pivotal role of workplaces in shaping the mental health of the population as a public health and development concern. Ladies and gentlemen, mental health is an integral part of our overall well-being. It encompasses our thoughts, feelings, and behaviors. It influences how we handle stress and how we relate to others and make healthy choices. Thank you. Unfortunately, mental health continues to be stigmatized and often overlooked, leading to significant consequences for individuals, families, and communities. A significant portion of a person's life is spent in the workplace, and this environment can have a profound impact on their mental well-being. While meaningful work can offer numerous benefits, harmful work conditions can lead to serious mental health issues. And the Task Force on Mental Health 2020 in Kenya underscored the critical role of workforce factors in contributing to mental health challenges among the Kenyan population. This highlights the urgent need for workplace to prioritize mental health, in the workplace. and create supportive environment for their employees. So ladies and gentlemen, mental health problems, as we know, extend far beyond individuals, as even we have listened to the experiences. It impacts families, communities, and the society at large. It equally affects the socio-economic growth in Kenya, with a loss of almost 0.6% of GDP, as was seen in 2020. But despite this, investing in mental health interventions again offers a significant return in investment over time. And the Kenya Mental Health Action Plan and the Task Force on Mental Health report prioritizes increased access to mental health services, including workplace mental wellness programs. Recognizing the importance of workplace as platforms for mental health integration, the Ministry of Health has developed the country's first national guidelines on workplace mental wellness. And these guidelines emphasize a collaborative approach to creating a health work environment with clear roles of all stakeholders. The guidelines focus on 3 key strategies: promotion, prevention, and care and support for employees. Employers are encouraged to implement mental wellness programs that address the overall mental well-being of their employees, prevent the occurrence or worsening of mental health issues, and provide care and support for those who require treatment. By prioritizing mental health in the workplace, organizations can not only improve employees' well-being, but also enhance productivity and contribute to socioeconomic development. And so our key actions and directives, even following the various speeches we've had today, number 1 is that counties deliberately invest in mental health clinics and addiction clinics in all level 4 hospitals. Equally, we are requesting that all employers implement the national guidelines on mental wellness. And lastly, as has been discussed here, school health programs are critical and they need to include mental wellness and addiction prevention. This includes the primary, the secondary, tertiary, that is the colleges and universities. And we have heard even from the testimonials today that it is critical we start with the programs from primary level, including prevention of substance abuse in the school region. And so, ladies and gentlemen, by working together, we can create a world where everyone can enjoy good mental health. Let us commit to breaking down barriers, fostering empathy, and building a society that values and supports the mental well-being of all. In conclusion, the World Mental Health Day is an opportunity for us to raise awareness, promote understanding, and advocate for the rights of individuals with mental health conditions. So let us work together to build a world where everyone can enjoy good mental health. Asanteni.
Let us give another round of applause to Madam Cabinet Secretary. Thank you very much indeed. We want now to go to the official launch. And ladies and gentlemen, allow me to kindly and humbly request Madam Cabinet Secretary to be joined by the CEO and also the representative, Dr. Barasa, from the Ministry of Labor. In fact, I humbly request that this entire row, please let's present ourselves there. Let us be led by the Cabinet Secretary. We will be launching, there will be a countdown. Cameras, that is where we are going to hold the remaining part of our presentations. If we can have Ladies and gentlemen, we are also going to participate in the countdown once we are ready. We want to kindly request that there will be some pyrotechnics of sorts. So let us be mindful. We are just assuring ourselves that the cameras are on. Once we are ready, I will have the signal. Three, 2, 1. Ladies and gentlemen, the moment is now. Ladies and gentlemen, that is the launch. Let us give a round of applause for the launch. Makofi tafadhali. Wow. Please let us make sure we give the cameras behind us the opportunity to also take their photos. We will take some more photos on the podium. Martin, be on standby. Wana CEO, we have a small presentation.
The rest, we can take our seats. I see you. Madam CS, we want to give you a gift, and this gift in appreciation for your finding time. National. Yes, if we can display it, wonderful. Can we clap for that? Well done. Ladies and gentlemen, with that, another photo, please. Thank you, madam. You may take your seats. Ladies and gentlemen, we have come to the tail end of our event. I want to now very humbly request Dr. Mercy Karanja, who is the head division of mental health, who will be giving us a vote of thanks. Dr. Mercy Karanja, karibu.
Please adjust. Thank you. Our chief guest, Dr. Barasa, Cabinet Secretary for Health, our distinguished and honorable guests, all protocol observed. It is my distinct honor to extend our heartfelt gratitude to everyone who has contributed to making this event a success. Hasn't it been a success? So can you applaud if it has been a success? Are you feeling mentally healthy? Yes, indeed. First and foremost, I would like to express our deepest appreciation to our esteemed chief guests, the Cabinet Secretary for Health. Your presence today, Madam Waziri, not only underscores the significance of mental health in our society, but also reflects the government's commitment to prioritizing mental well-being, particularly in the workplace. We are really grateful for you. Your leadership and advocacy are crucial as we strive to reduce stigma and enhance accessibility to mental health care for all Kenyans. To the various stakeholders represented here today, both state and non-state actors, we have very broad representation from various ministries, departments, agencies, from counties, from learning institutions, from professional bodies, from various development partners, representatives of workers and employees, healthcare providers are in the house, NGOs, CSOs, users and caregivers of psychiatrists, and many more. I may not be able to mention everybody here, but we are really grateful for honoring our invitation and for your collective efforts to making this a success. Your commitment to improving mental health care accessibility and quality is vital to as we work together towards a healthier society. To our speakers and participants who have shared their insights and experiences today, thank you for your courage and dedication. Special gratitude to those brave individuals, the two ladies who shared their personal experiences living with mental illness. Your courage in speaking out fosters understanding and compassion, helping to break down barriers and reduce stigma surrounding mental health. Let me also acknowledge and appreciate the resilience and dedication of our healthcare workers. Healthcare workers in the house, can you make an applaud? Yes, we are not often appreciated as healthcare workers, but your unwavering commitment during challenging time has been nothing short of inspiring. You're on the front lines, providing essential support and care for those facing mental health challenges, not only to help alleviate their suffering, but to promote mental well-being. The entertainers who have kept the crowd engaged. Didn't you enjoy yourself dancing here with Kayamba? Did you enjoy? Yes, for uplifting our spirits throughout the event and for the work that we took that also lifted our spirit. Thank you very much. Your performance not only brought joy, but also served as a reminder of the importance of the community and connection that we must always embrace. Lastly, I want to thank the volunteers, the sponsors, and partners who have worked tirelessly behind the scenes to make this a success. Thank you to the Ministry of Health and Mathari National Teaching and Referral Hospital for organizing this very successful event in collaboration with our various stakeholders. Together, Let us continue to advocate for mental health awareness and support one another as we work towards creating a healthier society for all. Asanteni sana and have good mental health.
Well done, Dr. Mercy Karanja. I appreciate the thanks for the entertainers. We appreciate. Normally, people forget about us. Madam CS, I'm sorry, we will ask you one more time, just one more time, to come and receive the strategic plan. This is because one camera iliungua. Film imeungua. So naomba tafadhali tuje hapa. Yes, there we are. So, Martin, stand by. Yes. Yeah, before you go, finally, si hata MC ni mutu. Ladies and gentlemen, we want to ask that we be upstanding so that we do the national anthem, and then we will be calling the day to an end. Ladies and gentlemen, the national anthem. Ladies and gentlemen, our meeting is over. I would like to humbly request that we remain standing as our chief guests and our other guests please leave. We will soon after follow. Enjoy yourself. Have a fantastic afternoon. Here we go.
Somebody that can go.